Guys, welcome back to Medical Coding with Blue. Today's episode is all about staying motivated when you are seeking your first job in medical coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, disclaimer first. This health information field is very tough. It is. And the whole thing about my channel is to help people. That is a whole thing for my channel, is to help people. However, I will say this. Some of the things that I'm going to say today is probably going to make some of y'all mad. And you're going to get mad for the wrong reasons, okay? I don't want you to get mad. That's not why I'm making the video. I'm making the video to make a point, okay? Now, I'm giving advice based on what I know, what I've experienced, and the things that I have wished somebody would have told me from the very beginning, okay? When I first started and I was looking for a job, I was looking for 2 whole months. And it was very scary because I was still working in basically dead-end jobs. I was, doing bartending and housekeeping and, working at a halfway house. I was doing all these things, trying to keep my head above water, trying to still have money coming in. And I was mad because I'd been through school and I'd done really well in school, and why couldn't I get hired? And it took my mom telling me go back to the school, and me going back to the school and asking for help and saying, what do I do? And then the school principal saying that, hey, you try to go to a temporary agency. And immediately I said, oh no, I don't want to do that. I want a real job. And he told me, well, all of these things will be onto your resume as experience. And that's what you need. You need to start somewhere. And with a temp agency, there's going to be ones that will give you a chance because they need a body to fill a seat. That's essentially what it is. So whenever a place is hiring or is looking for a temp to fill a spot for a medical coder, sometimes it is an audition. Sometimes they're looking at this person to see, okay, well, we're going to let the temp agency handle the background check and the skills check, and we're just going to try them out and see if we like them. And if we like them, then we're going to give them an offer to get hired on permanently. Okay? That's the way it works sometimes. For me, in my first position, it was 3 months that I got on at the temporary agency for the Cancer Therapy Research Center. Okay? It was a contract. And at the end of this 3 months, they had to pick a candidate. There was 3 of us, and then we were all brand new. And I didn't get picked. And it wasn't on technical ability. It was just the lady, the supervisor. And that's fine because I went on to another temp assignment that was supposed to be for 5 years. And it ended up, I was only there for 8 months because I had still applied and I was applying, and I finally got into my forever home. So what happens a lot of times to brand new coders is they get a very narrow frame of mind. They want things and they want it right now. And this isn't just young people. So if you're thinking, oh, it's just young people that think this. No. It's older people that think this as well. People that are in their 40s and 50s and, they're thinking this way. Okay, so then they want to compound it with, oh, my age. And age has nothing to do with it because I've known people. And like I said in the beginning, I went to school with that lady age 61. She's still working today. And she got her first job and she's been working. She's still working again. And I've been in the industry for 15 years. So you think about that. Do a little math there and you'll figure that out. So if you're thinking that is as a reason that nobody wants to hire you, that's not true. Because there's a lot of people out there that are in their 50s and 60s just barely starting in medical coding. But first of all, we need to stop with the complaining, okay? So I'm going to read what I posted from a viewer who I was trying to support. Somebody commented, I'm going to read that comment after this. So this was the original post where she or he says, billing, but even billing jobs want experience. Then what? I have no experience in billing either. So I really have run into multiple dead ends, even with a BS degree, Bachelor's of Science degree in the health field. I haven't even had my first interview in a sad face. And I said, you apply anyway. You apply with your 1-page resume that lists your skills. Do not let the job ad discourage you from applying. You still have to apply anyway. And I said, I'm saying this to lift you up. You can do it, right?
And I said in the original LinkedIn post, I said, if you're looking for a job in medical coding or medical billing, now is not the time to panic if you can't find a job right away. Get yourself a quality resume and apply, even if they're asking for experience. This is the part where people don't seem to hear me. So I'm going to say it again. Apply even if it's asking for experience. Why? Because if you are the only one that is applying and there's people who have experience in the area, they're happy where they are, and that employer doesn't get anybody else that's applying, but they get somebody who's brand new with a really good resume that tells them the skills that they're bringing to them. Not this bullarchy of only ICD-10. I'm organized and I'm a team player on your skills list. I would reject you. Why? Because there's two ICD-10s, ICD-10-CM and ICD-10-PCS. So you have to be specific. I have said that in the resume tip videos for brand new medical coders, which is watched a lot. I see it on the analytics. But there's a lot of people that want to sit here in that puddle of, oh no, they don't want to hire me, and even billers want experience. But watch this comment. Watch this comment. And this got me fired up too. So the commenter says, I'm with you. I'm so fed up right now too. I have a nursing background and still everybody is saying no. It is infuriating to hear people already established in the coding world tell you to just take a job as a biller or something else to get your foot in the door. I'm going to stop this thing right here for a second. When I give y'all these alternative jobs to apply for, I always tell you that it's your choice, that you can continue to apply for medical coding jobs, but these are things that can help if you need to get some money through the door and you need to get working. You can start off there. You do not have to stay there. You can make that a temporary stop, because being in the billing position is not so bad in the beginning. Because why? The codes are already selected. You're going to be able to look at them so that you can start familiarizing yourself with, oh, okay, this is what I didn't learn in school, because I see the already finished product and I can look at the documentation that goes with it, and I can learn about sending this in to the insurance company. And if that's not what you want to do, don't do it. Don't do it. Not even as an alternative. Go for another position that I've recommended, which is like prior authorizations. That has nothing to do with billing. You're dealing with the insurance company. But guess what? With billing and with prior authorizations, right? You get your exposure to the electronic medical record. So whatever electronic medical record they have, whether it's Epic or Cerner or eClinicalWorks or any of those things, that can go on your resume as well. You all need to stop looking at it like it's so insulting to get started in billing. And I can tell that that's the undertone of this post, because listen to this. Why would we spend all that time and money to do that? However, I've applied to billing jobs as well and still no. I'm really trying to stay positive. Still practicing with Practicode, but this is getting ridiculous. But you're not really staying positive, are you? You're upset because somebody said to try to apply at a billing job. They're telling you that to help you, and you're upset about it. And then you say that you went ahead and applied for it, but you didn't get it. Well, with that kind of energy, you're not going to get it. And I guarantee you there's a problem with the resume. I can guarantee it because I can see it from here. There's a problem with the resume. I guarantee you there is. I guarantee it. Because nurses often will make their resumes still sound like they want to be in nursing. What did you do in nursing that can transfer over to being a coder? Did you have to document, like take down the vitals and things like that? Did you do that in the electronic medical record? Okay, so which electronic medical record did you work with? I don't want to hear that you set up lines. I don't want to hear that you changed bandages. I don't want to hear that. I want to know about what did you do in terms of when you were working with the doctor. Is there anything that you had to explain and use your skills and use your critical thinking as far as like anatomy and all these other things, which you do on a daily basis? I know you do as nurses. But again, just the energy that I get from this, oh no, I wouldn't have. Because again, they're probably saying that they're looking for an entry-level position as well. And you can't do that. I have said that several times on my channel. If you're brand new and you're putting your resume out there, if on anywhere this says, I am seeking an entry-level position, I would reject you. Because again, that says to me, this is a person who wants their hand held. They know you don't have experience. They know this is going to be your first job because according to your resume, right, if it's done right, it's going to show, okay, all the transferable things that can apply to coding, protecting patient health information, having to use your anatomy skills, pharma, and all of these other things. That's what you need to have there. And on your skills list, I don't want to see organized, team player. I don't want to see none of that. I don't want to see none of that. I want to know your hard skills. ICD-10-CM. If you were trained in ICD-10 PCS, put that on there too. And you got to spell it out. And you can't do this ICD-10-CM/PCS. Because again, if I see that and I'm a hiring manager, I'm not hiring you. Why? Because it's lazy. You can't make another line for ICD-10 PCS. You can't do that. Because to me, again, these are two different things, two different mindsets. And you're trying to put them on the same line. Really? So they go on to say that the course only prepares you to take the exam, which I did, and I passed with a 91% on the first try. But none of that matters. Here goes that negativity again. The course does not prepare you to sit down and start coding and know things you weren't taught in the course. They tell you that when you sign up for Practicode. And then also, the apprentice opportunities are few and far in between. I've done a lot of researching on my own time to try to get familiar with what coders are doing out there. I am tired, and I'm tired of being told no because I have no experience in coding. And she writes that in big letters. Okay, I feel better now. Thank you for letting me vent. So I removed this comment from my LinkedIn thing because, again, guys, I don't want my audience to see these things because somebody else commented that they feel the same way. And when you do that, that just leads to more of that commiserating. People are going to start commiserating. And that's not what my pages are for. That's not what my channel is for. Why? Because I know what it's like to be a brand new medical coder. And I know what it's like to be out there searching for your first job. I know what it's like to have people look at you and say, oh, well, you have the CCA, so, oh, really? Oh, that's what you think. Okay, well, allow me to show you. Let me educate you. And I did several times. Doctors, nurses, other medical coders, and other people that were the ancillary staff. I was able to help them to see, oh, a CCA can do quite a bit. Yes, I can. And I did for 13 years. And I stubbornly held on to it because I wanted to show people this is what you could do with a CCA. And I was told several times, oh, you should get a CPC. Why? The CCA says that I know both inpatient and outpatient. So why would I go with just one credential who says that I only know one thing? Really? So I have the CCSP and the CCS now. Okay? I took those in 2021. But the thing that I want you all to understand is that nothing in this industry is just given to people. This industry means starting in places where you didn't think that it would mean that that's where you're going to start, right? I didn't think that I was going to have my first job at a temp agency, but I went with it. And guess what? That temp agency job led me to my second temp agency job, which led me to my forever home, because the skills that I learned in my second job with the temp agency was exactly the reason that I got this position, because I was learning professional fee coding over there. And that's exactly what they needed here. And so I said, well, this is what I do. And I listed all the specialties that I did for a professional fee. I listed however many records that I was doing at the time as well, and my accuracy. And I did all of those things. And I fixed up my resume. And when I submitted it and they called me, they were like, you know, that was a really good resume. Thank you. I like resumes. It's what I do. But, you know, I was able to stay with it because my goal was to get back home. That's what I wanted. I had to move away. Don't tell me that you can't move away, because I'm not telling you that that's what you need to do. I'm telling you my story. I started off in my hometown for 3 months. Then they said, okay, we have another assignment, but you have to move away. So I moved away. I had to do that. And you know what? It was the best thing I did. Because if I hadn't, I don't know when I would have been able to get another job. So then from that job is when I got here to my forever home. And I made it. But I had to be stubborn. And I had to not think about all these external things of people don't want me because I don't have experience. And that was really, at the time, that was the big thing was, well, you don't have experience. And, you know, some of those employers were like, oh, yeah, we accept CCAs, but we accept CCAs with experience. But, you know, again, it was, okay, then I got to go to the next one. And whenever I went on an interview and they said, well, you know, you did really well on the test, but we see that you don't have experience. So we have a policy with our facility and blah, 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 which I think is stupid, but, you know, whatever, you know. But for me, I was just like, okay. And then I started to think about it that, yes, I was frustrated. But then the more I went on those interviews, I was like, you know what? This may be just another interview where it's not going to go. But you know what? I can just go in here and I can relax because I'm meeting another person who is in this industry. And I'm going to get better with these interview skills. That's exactly how I looked at it. And then exactly how I looked at it too was, this is my goal. I've been in this school. I have an ex-husband sitting here saying I couldn't do it, and I did it. And that was also in my head too. No, I'm going to do this. I am not going to fail at this, even though everybody wants experience. And can you imagine, that was 15 years ago. They were singing that song 15 years ago. And another little factoid that I found out at the conference, they were saying back in 2015 when ICD-9 and ICD-10, when there was a changeover, the average age back then was 52. That was the average age of a medical coder in 2015 was 52. Now, I am still younger than 52, way younger than 52. But the thing about it is, guys, it does not matter where or when you get in. You will get in and you will persevere if you are applying yourself. And if you stop putting up these walls of, well, I'm looking for this apprentice job and I'm looking for this, I'm looking for that. Number one, arm yourself with a good resume. The tip videos that I have on my channel, they are on my channel. You can look for resume tip videos on Medical Coding with Blue, okay? You arm yourself with that. Number two, when the job listing says medical coder must have 3 to 5 years experience, hello, my name is Blue Garcia, and I'm applying for this job. I have no experience, but I'm going to apply anyway, because this is what I have to offer you. I have finished the school. I did all these things. I have all of this background, and here's what I can give you. And when they reject you, that's fine. When they post that job again, you apply again, because that's exactly what I had to do. When I was at my second job and I was saying I wanted to go home, because my mom was sick and I wanted to be with her. So the first time I had the interview, everything went great. It was a wonderful interview. And I was like, yes, I nailed that interview. Because they even asked me at the end, if you got selected, how soon would you be able to start? And I said, 2 weeks to the day I get the call. A month passes and I didn't get a call. And I'm sobbing on the phone to my mom saying, I don't know what I did. And my mom's like, no, it just wasn't your time yet. And sure enough, a few weeks later, the job opened again, but it was for an even better position. And I was like, Mom, I got to do it. And my mom said, go for it. And sure enough, that's when I got the call. But can you imagine if I had just given up just because they didn't call me the one time? I knew in my heart that was a good interview. I knew it. I could feel it in my bones. And I said, no, I'm going to apply for this job again anyway, because they're going to see my face. They're going to see my resume. They're going to know that I applied. And sure enough, I got the job because I had that determination. So again, not giving up when you get the first no, or not just only seeking those entry-level positions, or not just seeking only, oh, I only want to work remotely, or I only want to work part-time, or I only want to do this, or I only want to do that. When you remove those I only, that's when you get somewhere. Because once I remove that, oh, I only want a full-time job, I don't want a temp job. Once I removed that from my vocabulary and I went with it, doors started opening. Doors started opening. So you arm yourself with a good resume. You apply anyway if it's asking for experience. When you get rejected, you apply again anyway. And you keep applying to these places that are looking for medical coders, because again, I have said this so many times I should get a t-shirt made. If they're looking for coders and no one with experience is applying and they get desperate enough, they'll hire you. But they're not going to hire you if you don't apply. And that's how they stop a lot of people from applying, because they get like that and they start to feel defeated. And so for some people, they do a few and they feel defeated. So it really all depends. But again, if you do those three things, arm yourself with a good resume, you apply anyway even if they're asking for experience, and you apply again even when you're rejected, you will get further along than the person who stops at the resume. Okay? So I'm not saying this so that y'all can feel bad or feel worse or anything like that. But what I'm telling you is this: when a veteran coder is telling you to take another job, if you have to, you do not have to, but if you have to, take another job. There is nothing wrong with that. But if you want to say, no, I really want to get into coding, then you go and you Google temporary agencies for medical professionals in your area so that you can see what they come out with. Because sometimes these temp agencies, they get these contract positions or these contract jobs and they're looking for coders. So they need somebody to fill that seat, and that's how they get in. So that's why I'm saying to do that. But if you say again, because you have that, oh no, I don't want to do that, this shows ungratefulness to the universe. And you know what happens? You can't move forward. You have to be grateful for the experience. Even though it does really stink right now because of everything you have to go through. But it doesn't mean that you have to give up. And it doesn't mean that you have to spew all of this on the internet because you feel frustrated. Remember, none of these people know your situation or know what you're doing or what you've been through or what you're going through. And every time you make a comment like this, somebody on LinkedIn could be watching and saying, I don't want to hire that person because they have a bad attitude. Everybody's watching. I know exactly who this person is. And I know exactly who the other people are that had made comments like that before too. Still complaining. Where are you getting? Because remember, even though you may think, oh, well, no one saw that. Nobody who's a recruiter, or nobody who's a manager saw that. There's a lot of people that follow my LinkedIn page that are managers, that are recruiters. So you never know who's watching. So make sure that you check yourself when you're speaking out there. Be positive, and not a oh, I'm trying to be positive. Be positive, not try. Be positive, because you will get in there, but you have to be persistent, because those that give up so easily and those that want to just hand it to them, those are the ones that are complaining out there that they can't get it. But the more you put an effort in, and the more that you get out there and you get social, as far as like, okay, I'm going to apply for this job, I'm going to apply for this job, and I'm going to apply for this job. And when you get that test, that assessment skills test, you take it, you do the best that you can, so that way you can prove the employers wrong when they think that new people can't pass these assessment tests. Because yes, you can. Yes, you can. You absolutely can. And if you hear anything that I say today, which I don't know, people are going to get upset anyway. Oh, well. What I'm saying is this. Yes, you can. You can find a job. You will find a job. But you have to do the work. And that's all there is to it. There's no ins and outs of it other than just doing the work. And that's my message for today, guys. Thank you guys so much for watching. If this video helped you,
Please like, subscribe, and share, and I'll see y'all next time. Bye.